At home, the procedure is no different than it was during the dialysis unit training sessions. There are a few things you should check before you start your first home treatment. Be sure the room is clean and well lit. Locate the machine close to your bed. Ensure the 3-prong power outlet is properly grounded. To get started, here is a quick review of the main steps to begin therapy. Mask and wash hands. Prepare your supplies. Place a bag on the heater. Load the disposable tubing set with cassette. Attach the drain bag or drain line extension. Connect the bags. Prime the disposable tubing set with cassette. Wash your hands again and connect yourself. If the need arises to disconnect during your therapy, press the stop button. Put on your mask and prepare your hands with the special solution. Close the clamp on your catheter and the white clamp on the patient line. Open the new mini cap and disconnect cap packages. Disconnect your catheter from the patient line, placing the patient line in the organizer. Put the new mini cap on your catheter, then put the disconnect cap on the patient line. The machine will remain stopped until you return. To reconnect, mask and wash your hands to minimize any risk of infection. Remove the disconnect cap from the patient line, leaving the line in the organizer. Remove the mini cap from your catheter. Remove the patient line from the organizer and connect it to the catheter. Open the clamps to the catheter and patient line, then press the go button. The machine will continue your therapy from where it left off. The HomeChoice automated PD system is extremely reliable. Whenever the machine detects a difficulty, it will automatically stop the therapy, sound an alarm, and display the alarm detected until you resolve the problem. Press the stop button to silence the alarm. Identify the condition on the display and refer to the troubleshooting section of the Patient at Home Guide for helpful suggestions. If you have any difficulty resolving the situation, just call the Baxter 24-hour toll-free technical support line at 1-800-553-6898 anytime. If the difficulty remains unresolved, the representative will arrange for a new system to be delivered to your home within 24 hours in most areas. As with all Baxter renal products, you'll receive regular home deliveries of all supplies needed to perform your dialysis. They're delivered directly into your home by our specially trained drivers. You will also be in regular contact with the Baxter Home Patient Service representative, who's there to support home dialysis patients like yourself. If you travel or plan a vacation, Baxter will arrange for the supplies to be waiting for you at most destinations. If you have any questions after watching this video, please ask your healthcare professional for assistance. The procedures in this section of the video are also outlined in the Patient at Home Guide and in the Trainer's Guide under Programming and Troubleshooting. For in-center healthcare professionals and patients setting their own programs, the following will be of assistance. When shipped, a new HomeChoice automated PD system contains a standard program. To change the program, press the down arrow until the display reads Change Program. Then press the Enter button. For each parameter in Change Program, press Enter to select that option and the display will start blinking. To change the value, use the up and down arrows. Press Enter to save the change. When the parameter stops blinking, press the down arrow to select the next one. If you do not want to change a value, just press the down arrow to move to the next option. The Change Program feature is available in the Startup, Stop, or Alarm menus. To enter CCPD or IPD therapy, 4 parameters must be programmed. Press the down arrow once. The first parameter is the total volume of dialysis solution to be used for the therapy. This includes the last fill if the therapy requires one. Press the down arrow once. The second parameter is the total therapy time. Press the down arrow again. The third is fill volume. This is the volume of solution to be used for each exchange. Press the down arrow again. The fourth is last fill volume, which is the volume of the last fill to be delivered at the end of the therapy and left in the peritoneal cavity during the day. This will vary depending upon the therapy. Press the down arrow again. If a last fill is required, the dextrose parameter must be programmed. This means the last fill may be the same or different dextrose as the other fills, or a special bag. When the program changes are complete, press stop. The display will show the number of cycles not included, the last fill, and the dwell time, then return to press go to start. If high-dose therapy is required, the patient will be able to combine conventional therapies like CCPD or Tidal with additional daytime exchanges. For high-dose therapy, 7 parameters must be programmed. Press the down arrow once. The first parameter is total volume of dialysis solution to be used for the therapy. This includes day volume, night volume, and last fill volume. Press the down arrow again. The second parameter is the number of day fills. Press the down arrow again. The third is day fill volume. This includes the volume of solution for each daytime exchange. Please note, this may be a different volume from the night fill volume. Press the down arrow again. The fourth is night therapy time. This is the total time for the nighttime portion of the therapy. This time is fixed and will begin as soon as the patient completes his or her daytime exchange. Press the down arrow again. The fifth parameter is night fill volume. Press the down arrow again. The sixth parameter is last fill volume, which is the volume of the last fill to be delivered at the end of the therapy and left in the peritoneal cavity during the day. Press the down arrow again. If a last fill is required, the dextrose parameter must be programmed. This means the last fill volume may be the same or different dextrose as the other fills or a special bag. When the program changes are complete, press stop. This display will show the number of night cycles, not including the last fill and the night dwell. Then return to press go to start. If title is required, refer to the Patient at Home Guide or the Trainer's Guide, which covers this specialized therapy in detail. The most common alarm is a check line alarm. The display may read check drain line, check final line, check heater line, check patient line, or check supply line. For any of these alarms, the same process is followed. Check the line for kinks, closed clamps, fibrin blockage, or an empty bag, and correct it. When the problem is resolved, the machine will automatically restart. If not, there is a second alarm. Again, when corrected, the machine will automatically restart. Should the problem persist, the machine alarms a third time, and the stop button must be pushed to silence the alarm. When the condition is corrected, press go to resume the therapy. To bypass a phase of treatment or an alarm when it is safe to do so, press stop. Press the down arrow until the display reads bypass. Press enter. The display shows the bypass condition and sounds a warning alarm. To complete the bypass, press stop. Then press the down arrow until the display reads bypass again. Press enter, and the machine will continue with the next phase of therapy. Always remember, there are several tools to assist you with any difficulties that may arise. Baxter provides the Patient at Home Guide and the Trainer's Guide as useful references for most information, while the help cards offer simple-to-follow step-by-step instructions for common problems. Call Baxter Technical Support at 1-800-553-6898 anytime for assistance.